So, have you ever gotten a bill after your annual gynecology visit and thought, my doctor's office has to be trying to scam me? Today, I'm going to explain why that bill showed up and why your doctor's office may have absolutely done nothing wrong. So here's where patients get frustrated. Let's say you and your best friend come to see me. You both have heavy periods, okay? I do the exact same evaluation. I bill the exact same codes, but your friend somehow owes nothing and you owe $75. Then you call my office upset because your friend didn't get charged. But the reality is, I didn't charge either of you differently. Your insurance plans are different. So, three patients can walk into my office with the same exact problem and leave with completely different bills, which is crazy, I know. But it's not because I charged differently or your doctor charged differently. It's because their insurance plans are different. And this is why when patients ask me, how much is this visit going to cost? How much is this test going to cost? I often cannot answer that question in the office. Not because I don't want to, but because I don't know the details of every deductible in each patient, every copay, coinsurance percentage, and benefit structure for every insurance plan that walks through my door with a patient, basically. Your doctor knows medicine. Your insurance company knows your benefits. And unfortunately, which is very unfortunate, those are not the same thing. So, coinsurance. Many people understand copays, but aren't exactly sure what coinsurance means. A copay is a fixed amount. So, for example, sometimes you see it on your card, specialist visit, $40 copay. Coinsurance is different. Coinsurance means that you pay a percentage of the allowed charge. So, for example, your doctor visit allowed amount equals $200. If your coinsurance is 20%, then insurance pays 80% and you pay 20% or $40. But if you haven't met your deductible yet, then you may owe the entire allowed amount before the coinsurance even kicks in. And this is why two patients with the same exact visit can have completely different bills. So in our last episode, we talked about the annual exam and how it's different from a problem visit. And here are some things briefly that can turn an annual exam into a problem visit. If you have heavy periods, pelvic pain, menopause symptoms you want to talk about, vaginal discharge, itching, burning, odor, hormonal concerns such as PCOS, irregular periods, hair loss, or low libido. Trust me, these are all very important women's health issues. Please bring them up. I want to know about them. I just want you to understand that insurance companies may classify the evaluation of those concerns differently than an annual preventative care visit. So what I always tell my patients when they come in, I'm like, what do you want to focus on today? Do you want to focus on the annual preventative visit or do you want to focus on the problem? Because they're two separate kinds of visits. And if we talk about some of these problems that you might be experiencing during your annual visit, your insurance might also pick up on that just based off the coding for the visit that can equal a different charge because it's not just your general checkup that could include possibly a pap smear, always the breast exam and the vaginal exam. Now we're discussing and possibly even evaluating a problem. So that gets picked up on and that can change how much you owe your insurance company. It can change what type of visit it's coded as. And if your doctor's office isn't coding properly, then your doctor's office can actually get dinged a little bit as well. So a lot of times I want to answer you. I want to tell you how much this might be, but I just absolutely don't know. So your insurance company, depending on what is talked about at your visit and how the visit is coded and billed, might pick up on certain things. So say you came for your annual exam, but you have one of these problems. Your insurance company can pick up on that and bill you for that, depending on how it was coded. So also they sometimes look at the doctor's notes occasionally and bill things that way. So the cost of your visit, I'm just wanting to say, is not completely in your doctor's hands. Your insurance has a big, big, big part to do with it. And how much of your insurance you've used up until that specific doctor's visit is important also for how much you might owe if you've met your deductible, like I mentioned. So I just wanted to put this podcast episode out there because I wanted people to know that as much as we want to tell you how much something will cost, we don't know how much it will cost you. And that's unfortunate. It's part of the pitfalls, honestly, of medicine. There's no clear understanding. There's no universal way of doing things. Every single person that walks through my doors has a different insurance, a different plan. Even if they have the same insurance, they might have a different subset of a different plan. I mean, it gets kind of hectic. Yeah. But I will say here that my job as your doctor is to do the best for you medically. And yeah, sometimes that also means doing the best for you cost-wise, because costs can be a huge burden for people. So when I'm seeing patients, I try to do the most cost-effective thing or make the most cost-effective plan. Sometimes that might mean coming for 2 different visits. Sometimes that might mean we can do 2 things in one visit. Sometimes we'll run one test and not the other test now if it's something that you can't afford at the moment. It all depends on what's going on with your health and how urgent the problem is that we're dealing with. Because at the end of the day, your health is the top priority for me, and doing things medically accurately and getting the diagnosis that we need to get and getting the solutions that we need to get is of utmost importance to me as a medical doctor. Yes, insurance is in the back of my mind, but it's definitely not at the forefront. So what I encourage everyone to do is call their insurance companies and see exactly what their copays are, what their current coinsurance percentages are, how much of their deductible they have met, and what your insurance actually covers when it comes to an annual visit versus a problem visit, an ultrasound if you need to get that done. Where are the locations that are that you get the most coverage money-wise from your insurance, where you get your ultrasounds done? Your blood work, where does your insurance want you to go to get blood work where they cover it the most in terms of the bill? These things are really important to know, either from the insurance website or contacting them directly. So I always recommend doing that so you have an idea of your insurance plan. So the takeaway isn't don't bring up your symptoms. Please bring them up. If you're bleeding heavily, if you're having pelvic pain, if you're struggling with menopause symptoms, or if you're worried about your hormones, I want to know. The takeaway is simply understanding that preventative care and problem-focused care are not always viewed the same way by your insurance company. And that's it. Thank you guys so much for listening to the For Vaginas Only podcast and watching the For Vaginas Only podcast. If you have caught me on YouTube, we're there now, so you can view me and the podcast episode. And I will see you guys on either my Instagram at For Vaginas Only or at forvaginasonly.com. If you have any questions, I am not a biller and a coder. I know the parts that I need to know, but please, if you have any questions, write in the comments below and I will try to get to you if I know the answer. And I'll see you guys in the next episode. Bye.